What's going on, everybody? My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Valentine's Day, everyone. Happy Monday. Hope you guys are enjoying your Valentine's Day. Drop in the comments any special gifts that you got for Valentine's Day. I'm always interested in knowing what you guys got. Hope you guys had a good weekend, and as promised, I'm going to go over a pretty awesome question that somebody had, but this was also similar to an experience that I had last week. Are babies born with an immune system? Okay. I will tell you this, one of the reasons why I wanted to talk about this, because if you are familiar with what is going on in Illinois, is that for many of the schools in Illinois, starting a week ago last Monday, there was a temporary restraining order given by a judge. I was actually part of the case, and she said you can no longer make masks mandatory, and you need to go through the proper legal channels in order to do anything in regards to separating a child, making them mask, making them go home, contact trace, and everything like that. And so it was really interesting seeing what went on for the last week, because you really got to see who the people who understood what the immune system was, how it worked, versus people who have no idea, living quite honestly in fear, and aren't able to think through things with logic and with reason. And so something happened interesting last week with my son, because of course he wasn't wearing a mask, and one of his teachers during class demanded that he put it back on, as well as everyone else in the class that wasn't wearing a mask. And the reason why was because she was pregnant, and she said, if you don't wear a mask and I catch COVID, then you are going to kill my baby. So talk about the mental abuse that those children had to go through in thinking that if I don't wear a mask, I'm killing other people. We won't even need to go into the science behind particle size and the size of what the mask allows to go in. It was absolutely crazy. Principal got a call. So that was quickly reversed, and it didn't happen again starting the very next day. But another aspect is there's a lot of bad information out there that is told to pregnant mothers, mothers with infants, and the narrative actually says that, hey, basically, babies don't have an immune system, and so they're literally they have to be isolated, they have to be kept away from everybody else because they don't have the ability to be able to fight an infection. And this is also true with a number of people who have come to me and said, my daughter or my daughter-in-law, they won't let me even see the baby because, they're afraid that the baby's going to come down with some terrible disease. So the question that I'm going to ask is, are babies born with an immune system? And you might be maybe pleasantly surprised when we answer this question just based on science and based on physiology, okay? So are babies born with an immune system? Well, if you guys go and you look up PubMed, I looked up a pretty recent article, I think this was from actually last year, and they asked this question, is the newborn human natural killer cell repertoire is phenotypically formed, but it's functionally reduced? And that's a lot of big words, in which they say that a newborn baby does in fact have what's called natural killer cells. Natural killer cells have the ability to be able to fight off viruses, okay? And so that's when you get into what's known as the adaptive immune system, and you have the innate immune system. So the innate immune system is what we are actually born with. That's why it's called innate. And you have certain white blood cells, and you have barriers and things like that are your first line of defense towards any kind of foreign protein, including a bacteria and a virus, or even a food and things like that. So babies, first and foremost, do have, in fact, they are born with a functioning immune system, and what's functioning perfectly is what they're born with, which is called your innate immune system. But a lot of people think that babies are left absolutely defenseless to anything in regards to a virus, and that is not true. And the reason why is when they actually say this, they say newborn babies already have a form of cell that allows them to be able to have viral protection if they need it, if it goes that far past the innate immune system, and they are called natural killer cells. Now, what they just say in this article is they say, hey, when we extract the cord blood from a newborn baby, and then we look at someone like a mature adult, is that those natural killer cells look exactly the same, but functionally they're a little bit different. And here's actually what they say. They say because newborns have to rely heavily on the innate immune system, and guys, I'm going to tell you something, we all should rely heavily on our immune system, including adults, because if you have a very poor innate immune system, then what happens is that you are going to have a really, really bad day when it comes to having to rely on your adaptive immune system, obviously, all the time, guys. And if you have a really great innate immune system, more than enough is that is enough for your body to be able to handle. Because remember what we're always saying, I'm going to talk about this a little bit later, is that really your immune system starts with the barriers, then the innate, and then finally the adaptive. And it really is the health of your immune system really comes down to barrier function first and foremost. So what they said is this: the structure of the cord blood, now this is actually what is known as where those natural killer cells are being given to the baby from the mother. So this is really important, is that natural killer cells are dependent in the baby. They are dependent on if the mother can give that to the baby or not, which also is going to play a role in if the mom doesn't have a healthy immune system, then the baby's not going to have a healthy immune system either. And so they say that these cells are very similar between the cord blood and then in adults. But what they say is that cord blood natural killer cells show reduced degranulation, cytokine production following target recognition, as well as antibody-dependent cell-mediated cytotoxicity and apoptosis-inducing induction in targets. So what they say is yes, it looks the same, but it just doesn't quite work as well as a healthy adult's natural killer cells. Now you may wonder that that's actually a problem in newborns, like that is some kind of defect. And I'm going to tell you that it is not in fact a defect whatsoever. One of the reasons why is, this is what's really interesting, is that when you look at pregnant mothers, you are going to see a decrease in an immune response clear across the board. And you think, oh, well, that must be terrible. No, it's actually really good, because I want you to remember something, is that when a woman becomes pregnant and that egg is fertilized, 1/2 of that egg contains a genetic structure that is not theirs. It is a foreign DNA. And so you can imagine if their immune system was at where it is when she's not pregnant, then what would happen is that these natural killer cells would identify that as a foreign body, would attack it and would kill it. And so really what would happen is we wouldn't actually continue as a human race, because every single pregnancy would actually end up as a spontaneous abortion. So the immune system actually does have to go down in order for the baby to be able to survive. This is why, if a woman has some kind of autoimmunity and she gets pregnant, actually she'll feel the best during pregnancy because that immune response is actually lowered. And so it's needed in order for the baby to be able to survive, so that those natural killer cells don't attack the fetus, don't attack the baby. So once they're actually born, then yes, of course, they are going to have a decreased immune response, because remember, they're coming from mother, and the mother will actually pass on those natural killer cells to the baby. And they don't work necessarily as well, but they still work up to a certain point. So does a baby have an immune system? Yes, they do. They're born with barriers. They have stomach acid production. They have these innate immune system cells, like neutrophils and eosinophils and basophils, and they do have certain white blood cells as well. I mean, they have those things. And so the job is that they do have these natural killer cells in response to viral infections. But one of the things that's really interesting is that at 13 weeks, mom will start to pass on her naturally occurring antibodies to other illnesses through the placenta, which makes it really important, because I want you to think of this. if mom had been vaccinated, for example, against the measles, that those titers will continue to go down, which is why when you do a titer on specific antibodies to measles, a lot of times you won't even see those even exist after a few years. Sometimes it might be only 6 months, sometimes it might only be 5 or 6 years. And that's why when they're young, they kept saying, you need to get a booster. You need to get a booster. Heck, if you got boosted up until like high school or maybe even into college, and it's been 20 years past that, I'm going to tell you guys, you have no antibody protection against the measles whatsoever. Now, if you had a natural infection, then that would last a whole heck of a lot longer because you went through the natural methods, natural routes of infection, and the antibody levels will persist for a lot longer period of time. And you would then be able to pass those antibodies onto the baby to be able to provide them protection via the cord or via the placenta, and then afterwards when you are breastfeeding. So do babies have an immune system? Well, the answer is a resounding yes, and they even have some of those antibodies that mom has gotten through a natural infection. And then number two, those antibodies actually get passed along through breast milk, okay? Which is why it is so important to breastfeed, which is why it is also so important that mom has had the natural routes and natural methods of infection so that she can pass on her antibodies to be able to provide the baby an extra level of protection, okay? So just remember this, babies are born with viral protection from their mother, meaning they're getting mom's natural killer cells. Now what happens if mom doesn't have a lot of natural killer cells? Well, then baby's not going to have a lot of natural killer cells as well. What I find from this article, this is what's interesting, guys, because I don't know how they come up with these conclusions, because what they actually say at the bottom is they say this. They say these findings show that the structure of natural killer cells repertoire is intact at birth, suggesting great potential for vaccine and therapeutic strategies targeting this cell population. This is what's so interesting, is because they're actually talking about infection being a leading cause of death worldwide in babies under 1 month of age. So they're saying, well, infection is a leading cause of death in babies under 1 month of age. Maybe we should be giving them and developing vaccines for babies under 1 month of age. But here's what's the kicker, is that babies don't have the ability to even make their own antibodies until a minimum of 3 months of age. Antibody production in babies doesn't start to develop until 3 months, 4 months, 5 months, or sometimes even 6 months of age. Which makes you wonder, look at the vaccines your baby has gotten at like before they left the hospital and then at 8 weeks, and they don't even have the ability to make antibodies against whatever antigen they're injecting into your baby. Isn't that incredible? In fact, I've even asked doctors, I say, hey, why are you giving the Hep B vaccine right at birth if they don't have the ability to make any kind of antibodies? And I've had doctors actually tell me, we're just training the patient to be compliant. It actually does absolutely nothing. We're just training the patient to become compliant, to start bringing them back for these, whatever that 2 months, at 6 months, 3 months, 6 months, 9 months, 12 months, or whatever the vaccine schedule actually is. It really makes you wonder that they're actually saying this is great potential for vaccines, especially under 1 month of age, when they can't even make their own antibody production. They actually should be getting it from their mother, either through the placenta while in the womb, or then after that, getting it from the breast milk, okay? So, immune system. How do you get your baby's, or how do you start developing your baby's immune system after birth? Well, this actually comes from a research article. We got it from PubMed back in April 9th of 2020, so about 2 years ago. And then they said breast milk, a source of beneficial microbes and associated benefits for infant health. And here's what they said. Breastfeeding is associated with improved infant health and immune system development. Wow, you mean you can actually develop your immune system? Most people think that the immune system is just static, that you have it and then it doesn't change or doesn't have the ability to change. Heck, the whole narrative that we've been through that is quickly eroding and crumbling has actually said nothing about developing the immune system. It's like the only way for you to have any line of protection is not to do things that are going to support the production of certain immune system cells. It has only been about just getting a vaccine. That's the only way that you're going to be protected, which is so far away from the truth. It is absolutely mind-boggling. So they say it's important for immune development, less incidence of gastrointestinal disease and lower mortality rates are present in breastfed than formula-fed infants. As well as providing fundamental nutrients to the growing infant, breast milk is a source of commensal bacteria which further enhance infant health by preventing pathogen adhesion and promoting gut colonization of beneficial microbes. So you have a whole microbiome, 75 trillion cells that live in your colon, and you have to populate it some way. It actually gets populated when the baby goes through the vaginal canal. That's one way to start populating it. Another way to start populating it is actually through breastfeeding. So what happens if you have a baby that is a C-section and you have a baby that is formula fed? And what you're going to see is you're going to see very poor development of that immune system. And we even see babies that come in and they are suffering with colic, tremendous colic. Basically, they cry all the time. They arch their backs, like this way. And the reason why is because they have so much gastrointestinal bloating and pain, and they're just screaming bloody murder. A lot of it can be because of how they were born, and it could also be because they're getting formula fed, and they're feeding them a formula, or doctors recommending a formula that their body doesn't even have the right enzymes to be able to break down, and the only thing that it's doing is causing a bunch of gastrointestinal inflammation. So can you develop then the immune system? Yep, and the best way to do it is actually through breast milk. I know I'm going to get a question of saying, well, what if I can't breastfeed my baby? And a lot of times, number one, is that doctors will just encourage the mom to just give up way too soon. But the other thing is, yes, there are some circumstances where mom's not able to breastfeed the baby. We actually will recommend that they find someone who's got donor milk. And if that is not feasible, then we have a recipe as well that is as close as possible to breast milk that they can start to make that's not going to have any inflammatory types of foods and proteins in it, which would lead to having a lot of gastrointestinal upset and having a lot of colic. So breast milk is important, okay? Now, the other thing I want you guys to understand is that babies are given antibody protection via mom's previous exposure through breast milk as well. So not only is it providing the nutrition, not only is it providing the healthy gut microbes, but it's also providing antibody protection based on what mom had been exposed to in her life, which is really, really, really important, especially if she had a natural infection. What if she had gotten COVID naturally? What if she had gotten measles naturally? What if she had gotten the chickenpox naturally? She's passing on those antibodies through the breast milk. This is one of the reasons why, guys, babies should be exclusively breastfed until 1 year of age. And I know I'm going to catch a lot of flack for it, but babies are born with a leaky gut. And the reason why is because those things that are in breast milk, if the baby had an intact gastrointestinal barrier like this, those things would not be able to pass through. And so instead, babies are born with a leaky gut so that some of these large proteins like antibodies are able to go through and provide protection to the baby. The gut barrier does not close until around 1 year of age, which is why at 3 months, when they say give your baby rice cereal, one of the worst things that you can do, because all that's going to happen is that those rice proteins are going to leak through, and it's going to inflame the gastrointestinal system, and it's also going to inflame the skin. Go back and look at your own kids when you gave them specific foods and you saw that they broke out in a rash, hives, eczema, whatever it might be, and it's because you were giving them food that they weren't breaking down and those proteins were leaking through the gastrointestinal barrier. So this is why ideally the best thing that you can do is exclusively breastfeed through 1 year of age until that gastrointestinal system actually starts to clear up, the development of teeth and the right type of teeth so that they can actually tear, break down, grind food. So a lot of times you say, when do we recommend giving food? Well, just look at the development of the teeth. So when they start to develop the incisors, that's meaning they can start to tear food, which they might be able to tolerate meat. Once they start getting the front food, usually they can start tolerating like soft or mushy type foods as well. But you really, really ideally want to exclusively breastfeed up until about 1 year of age, until they start getting the development of the teeth, okay? So here's what's interesting. I said this before, is that antibody protection is not fully developed until around 6 months of age. And if that is true, then why are we vaccinating our kids at 8 weeks or at 3 months or even at 6 months if, even though they're trying to stimulate antibody production, what's happening before that? Like literally, are we just putting antigens in the body that the body can't necessarily handle and can't form an immune response from it as well? Or are we just actually really telling or just teaching, parents just how to be compliant? Now, the other thing too is think of this, because there are certain chemicals in vaccines, and if you look at the ingredient list, you'll say like, well, that's probably not good to be injected straight into the body. A lot of people make this, they make this saying, well, there's these chemicals, they're in our food or they're in our water. I'm like, well, it's actually safer because you're actually ingesting it, and at least you have the protection of the gastrointestinal barrier. So, but when you are going straight through all the barriers directly into a blood supply, then you are bypassing all the barriers and causing direct exposure. And when it comes to specific enzymes to be able to induce detoxification in babies, some of these things within the liver aren't even further developed until about 12 months. This is why they say you got to be really careful giving your baby Tylenol, because there's certain enzymes within the liver that properly metabolize these things so that they can get rid of it, which is why sometimes Tylenol, you give it to a 6-month-old and it causes liver damage as a result. And so this is why you really have to be careful when it comes to what mom is eating, what you're feeding the baby, and what the baby is actually exposed to, because they don't have the ability to be able to clear out toxins before 12 years or 12 months of age. So remember, we just said this. Do babies have an immune system? Yes. They're not left defenseless, okay? Because when you look at the proper immune response, guys, it begins at the barriers, then it's your innate immune system, and then finally, if needed, it's the adaptive immune system. And if this one here is strong, this will serve you well. If this one over here is strong, that will serve you even better. And that this right here, that adaptive, is not the most important thing when it comes to your immune system. When you look at the sickest people are the ones who have the worst barrier function within the stomach, within the skin, within the gastrointestinal lining, within the genitourinary tract. When those barriers break down, it's like the breach in the castle wall, and then there's going to be so much more exposure that the innate and the adaptive immune system, it needs to do a lot more work, okay? So what can you do to strengthen your child's immune system? What on earth can you do to strengthen your child's immune system? Well, think of this, that the child's immune system is no different than a muscle. If you remember, your child learning how to walk, you wouldn't have said, just stood them up and they fell down, and you wouldn't say, you know what, Johnny, I think you don't have really what it takes in order to be able to walk, so we're just going to keep you in the stroller for the rest of your life. I mean, can you imagine a 25-year-old still in a stroller? You say, well, Johnny just didn't have what it took. When it comes to learning how to walk, you let them fall down, you let them cry, you let them learn how to walk, because it's them failing do they learn neurologically and also be able to stabilize themselves within their core strength to finally be able to develop the strength and coordination to be able to walk. But for some reason, when it comes to our children's immune system, all we do today in our school system, in daycares, and even with a lot of parents, is we try to do everything we can to coddle the immune system to try to get them as least amount of exposure as possible. And somehow we're surprised when our children go to school after we've coddled their immune systems and they're exposed to new pathogens and now they're sick all the time. So how do you develop the strength of your child's immune system? You do it through actual exposure. You do it by just doing it according to how the body was designed. So first thing that you can do is breastfeed. Second thing you can do is how long do you breastfeed? Okay, for as long as possible. You know, we recommend at least 12 months. Don't introduce any food up until 12 months because the gastrointestinal barrier is still leaky. You know, that's just some basic things that you can do too. The other thing is I mean, we adjust numerous kids, you know, literally from like just being born, you know, up until 1, 2, 3 years of age, because there's birth trauma. Birth trauma is a stressor on the nerve system, and if there's a stressor on the nerve system and that baby is in fight or flight all the time, then their immune system is not going to work at the capacity that it needs to as well. So this is why I have 3 kids. They've all been adjusted from 20 minutes of age. I have 3 kids, 15, 13, and 11. Here's what's interesting. They've never been on a medication. They've never been on an antibiotic. They've never been anything. And no, they've never been vaccinated either. Never. Have they been sick? Absolutely. We don't try to stop them from getting sick. Have they had a fever? Absolutely. We haven't stopped them from getting a fever because the fever is the cure. We haven't stopped them from getting sick, but we realize that if we've done the things necessary in order to facilitate the immune system, then what God gave them is enough. Let me say that again. If we do the right things, what God gave them for their immune response is more than enough. And I'll give you a perfect example right here. This is in my 15-year-old, and we tested all of his immune responses. So a lot of you have asked for, like, what on earth is this test? Guys, I'm going to tell you again for the 99,000th time, this is a CBC with differential, and we're also looking at CD4, CD8, CD19, and natural killer cells, okay? So when we look at this, and you look at all of these different types of T cell response, B lymphocytes, natural killer cells, guys, looking at this, you can't get this more perfect than it is right here. So looking at these numbers are literally perfect. And the thing is my son doesn't have superior genes. He's got normal genes, but what we have done is we have done everything we can to help his immune system. We've done nothing to kill it off. We've done nothing to cause a hyper inflammatory response, which happens in so many kids. And this right here is a perfect immune system response. That can happen in anyone. That's possible in anyone. That's the beautiful thing. We just haven't done things in order to interfere with it. So when you look at this, I wanted to take this, you know, to the school system and say, look at, here's a perfect immune system response, is that this whole COVID thing, it doesn't pertain to him. He's not at high risk, okay? He's not at high risk. He has a normal immune response, and yes, he had COVID, and yes, he basically didn't feel good for 1 or 2 days, and that was it. We allowed him to have a fever, we allowed him not to feel well, and his immune system was able to fight it off, and he's better as a result for having that because we got to flex his immune system muscles, and now his immune system is stronger as a result, okay? So hopefully, guys, that makes sense. Do babies have an immune system? Absolutely. But not only that, is that a lot of their immune system has to do with the health of the mother, and a lot of the immune system after they're born has to do with them breastfeeding and then helping to not interfere on how to allow that immune system to be able to develop and not do anything that's going to be causing an immune system response, okay? Guys, please share this video too. This is so important because I know that there are so many like grandmas who have literally not been able to see their brand new grandbabies because of this very thing, because that a lot of mothers have been given a lot of misinformation and disinformation regarding babies and the immune system. So guys, one last thing before I go off and enjoy the rest of my Valentine's Day is if you are from like the Chicagoland area, we have an awesome event that we have planned. It's coming up this Saturday. I think it's February 19th. And actually the gym that I own as well with my wife, CrossFit Exemplify, we're doing an event over at Urban Ops, which is in Oswego. This is an event on situational awareness, just basically like how to be able to handle emergencies or handle threats, being able to fire a weapon under duress. Really awesome as far as being able to protect yourselves during some strange times, obviously, that we're in. This is really going to be a good event. I'll be there. It's going to be awesome. It's from 10:30 to 1 o'clock. And if you go to the top of our Facebook page, I think we have that now as an event, and go and register for it. We actually have a Special Forces individual who is going to be teaching this. So it's going to be really, really awesome. I think everyone should have at least a basic level of understanding of how to protect yourself in dangerous situations. Guys, even how to fire a weapon, especially in the times that we're in as now. And so make sure you go to that and register for it. I think it's $60, which includes like 40 rounds of ammunition and instruction for like 2.5 hours. So it's going to be really awesome. I can't wait to see you guys there. So guys, I appreciate you guys being on here. I appreciate you watching me during Valentine's Day. And we'll be jumping on a couple of times probably by the end of the week as well. So again, guys, I always appreciate your likes. I always appreciate your shares. I'm humbled that so many of you watch, and I always appreciate every single one of you. I try to read all the comments as much as I can. And so I always appreciate, guys, your kind words. So guys, be well. I hope you have an awesome rest of your night, and we'll talk to you guys very soon.